You're absolutely right. I mean, there's 15% of the population generally experiences tinnitus, with 5%, around 5% being bothersome. There are some really great organisations like Tinnitus UK that we work well with, and the American Tinnitus Association that we work with. But we're also keen to help support clinicians on our own. So we've actually developed a thing called the Tinnitus Masterclass, which is focused very much on providing a structured approach to tinnitus education. It doesn't focus on any particular treatment mode, or it actually focuses on them all. It's treatment agnostic as such. It's a totally online course that can be done over any period of time that you like. It is a mixture of everything from the basic knowledge that you need to know for tinnitus to the core skills that you need to treat tinnitus patients, and then also the business side of things, that if you want to incorporate tinnitus into your business, how do you do that, and what are the important things that you need to know. So we work with other tinnitus experts to help pull some of that together. We also, beyond the Tinnitus Masterclass, we support as many patient organisations that we can. We work with regulatory bodies as much as we can to try and help people just understand that bimodal neuromodulation and Lenire is a really fantastic treatment for tinnitus. There are very few truly dedicated tinnitus companies, because tinnitus isn't easy. you know. There's no cure for it, so everything is a treatment. So it's not always the easiest thing to do, and that's why it has taken us quite some time to really produce really good quality evidence to show that what we do really, really works, and then build trust in that it actually works. And certainly in the last 12 to 18 months, there's been a real sea change in both the profession and also in general awareness that, one, tinnitus, people are becoming much more aware of tinnitus, but also in the profession, people are becoming much more aware that you can actually treat it. It's been really refreshing the last few days to talk to lots of clinicians that are really excited about the idea of having something that they can really do to impact someone's tinnitus in a simple, easy and effective way. We're constantly trying to raise awareness that tinnitus can be treated. Okay, a rising tide lifts all ships. Okay, if every GP, every ENT, every audiologist, anyone who worked with people with tinnitus knew what the treatment landscape was like, then patients would benefit, and that's what we're really focused on. Yes, people would then come to Lenire for sure, but they would also access the other treatments that do work, and really changing the narrative from you can't do anything about this, or you just have to live with it, which is so common to hear. And for a tinnitus patient can be really quite devastating. But getting that change to, there is something you can do about it, and these are the options that you can use. That's a pretty big task to take on, and we are committed to really trying to change that narrative. But I think we will do that very much with partners throughout different areas within audiology, within patient care, people like Tinnitus UK, ATA, when there's guidelines that are updated. So it's always the challenge of communicating something that's factually accurate and evidenced in a way that both the audiologist or the HCP and the consumer really, really gets. It's a constant challenge, but I think we do it quite well. We try to really focus on what the benefit is to the patient at the end of the day.